Today we will learn the histology of the liver. Liver, we all know, is an largest gland of the body and largest internal organ of the body. It is exocrine as well as the endocrine gland. As the exocrine gland, it secretes a secretion through a duct, that is bile, and as the endocrine gland, it synthesizes many things, that is the plasma protein, albumin, coagulation factor, lipoprotein like VLDL, SDL, LDL. It convert glucose into glycogen as well as the glycogen into glucose as per the need, and it detoxify the toxin. It metabolizes many drugs. Likewise, it has got many function that comes under the is endocrine part. Okay, now its weight is 1.5 kg, and it consumes 2.5% of the cardiac output. It lies in the right hypochondrium epigastrium as well as a small part into the left hypochondrium. It is enclosed within a fibrous capsule that is known as Gleason's capsule. Anatomically, it is divided into right lobe and the left lobe by the presence of umbilical fissure. This orange one is the site of umbilical fissure, where is the falciform ligament is attached, which divides the right lobe and the left lobe. Left lobe constitute 1/6 of the total. Okay, but Koinus, Dr. Koinu has given in 1957. Dr. Koinu is given anatomical surgical classification in which the dividing line is the Cantillies, which is shown in the red color. Cantilli, Cantlie apostrophe S, Cantillies line, which passes through the, it is an imaginary line which passes through the middle of the groove of the inferior vena cava up to the middle of the gallbladder and runs in the line of the middle hepatic vein. This is the Cantillies line, and this is left lobe. Left of it is the left lobe and the right of it is the right lobe. Now again, according to the surgical classification, it is again divided into 8 segments and it runs clockwise fashion. First come 1, but it is pushed backward. 1 is here. In the back side, it is 1, that is the caudate lobe. Caudate lobe, which lies in between the fissure for the ligamentum venosum and one side fossa for the inferior vena cava. Below there is porta hepatis, and superiorly it is continuous with the superior surface. This is our caudate lobe. It is like a pampered kid because it gets 2 set of the portal tract, that is the portal tract, that is the bile duct and the hepatic artery and the portal vein. Bile duct green color and the hepatic artery in red color, and this one purple is the portal vein, getting 2 set from the right and the left side. Actually, the whole of this scenario starts with the GIT, as the liver is in between the circulation. In between the one side there is GIT, whole of the gastrointestinal tract, the spleen and the pancreas, and at another side the whole general circulation. Liver is in between these two circulation. It receives the blood from whole of the GIT as well as the spleen and the pancreas. From whole of the GIT, all the nutrients are coming into the liver for the further processing, and the spleen through the spleen, the the breakdown product of the RBC, platelet, WBC is coming out, which is engulfed by the kapha cell, and through the pancreas many much hormone, that is the insulin, glucagon, are coming and so their role inside the liver cells. So and also through the GIT the toxins are coming, which is detoxified in the liver, then the blood is pushed into the general circulation. So liver is like a guard in between these two. Okay, now this so the liver got its blood supply, the fully oxygenated in red color, is through the hepatic artery, and this is in hepatic artery, it is directly coming from the it is the part of the celiac trunk and coming from the abdominal aorta, and this portal vein is coming after, it is the venous at the venous side that forms by the fusion of the superior mesenteric vein and the splenic vein behind the neck of the pancreas, they are forming. And now both from this portal vein it receives the splenic vein from the pancreas as well as from the GIT, and this is oxygenated, whole oxygenated supply from the aorta. So from both sides the blood is coming into the liver through the right and left portal triad, through the this is porta hepatis, all are passing through, the structure are passing and coming out through this, but for the clarification I have shown from outside. Okay, so this is coded the first lobe, which is a pampered kid, which receives from both right side as well as the left side, and it has got separate drainage system into the inferior vena cava. So that's the reason why it is escaped from many more infection, as this has got separate venous system and separate blood supply. Now coming to the second lobe, this is the second surgical lobe. It runs in the clockwise, then third, then fourth again divided into A and B. A is coming above, A for above, so it comes above, then 4B. Now again clockwise, fifth, sixth is behind, then 7, and then 8. Here in the right side, it is the segments are arranged anterior and posterior, and in the left side segments are arranged medial and lateral. Okay, and how are they divided, on which basis? Because they are getting their own set of portal triad, that is the hepatic artery, portal vein, and the bile duct. All this segment has got its own, and now they are coming into the segment where many much classical hepatic lobules are there. These are the hepatic lobules in which hepatocyte lies. Okay, these hepatic lobules are millions in number in whole of the liver. Okay, now coming to the inside structure of a hepatocyte. This is one classic hepatic lobule. This black one is the sinusoids. These are all sinusoids. And this is the portal tetrad. This is hepatic artery, this is portal vein, this is lymphatic system, and this is bile duct in green color. The blood is coming from the hepatic artery and the portal vein, and they are poured inside the sinusoid. Then it get mixed, and here in the sinusoids lie the kapha cell, which engulf the Proteus vulgaris. Proteus vulgaris is an organism which is very much fond to invade liver. It engulfed that Proteus vulgaris and also many much microorganisms which is dangerous for our body. Okay, and this Kupffer cell has also a role to engulf the breakdown product of RBC, WBC, and the platelets. Okay. Now blood is coming to the central vein from all sides. Okay, it is hepatic lobule is hexagon in shape, and it is arranged like many much hepatic lobules are there in this slide. This is one hepatic lobule which I have in last form. It is here. Okay, and the flow of blood is towards the center, so centripetal arrangement. This sinusoid has got this perforated wall. These are made of endothelial cell which has got gap in between, and the basement membrane over which the endothelial cell lies has also got perforation, and so blood is coming into this yellow space that is called subsinusoidal space or a space of Disse, and the blood is coming out from here to at this yellow side, the space of Disse, and then going back through the perforation again into the sinusoids and going to the central vein. This I have shown only once, but it is many times. It is coming, going, but the amount of blood is not returning back in the same amount which it enters into the space of Disse. The some amount of blood remain here and is called lymph, and this lymph has got drainage through this yellow lymphatic system. Okay, this is our space of Disse where the flow of lymph is centrifugal. This arrow shows that it is going from the center to the periphery, so centrifugal. And these are the plates of hepatocytes. These are hepatocyte, the liver cell. Okay, if we look liver cell, it has got microvilli towards the side of a space of Disse. There are microvilli. The many things are taken by the microvilli inside the liver cell. What are these? Like bilirubin, which is present in the blood. Bilirubin is the degraded product of RBC, and they are coming from spleen through the circulation and coming to the sinusoids, then coming to the space of Disse, then through the microvilli it enters inside the hepatocyte. This is our hepatocyte where the bilirubin get conjugated and then delivered into this space. This hepatocyte is a multi-phased cell, has got multiple phases. One side is towards the space of Disse where there is lymph, and one side is in between the hepatocyte, and there it forms a space that is called the Biliary Canaliculi. And from this Biliary Canaliculi, this is duct of Herring through which this bile is coming into the cholangioles. This is cholangioles, and through the cholangioles, this here is the Biliary Canaliculi, and this is duct of Herring, and this is cholangiole, and now coming into the bile ductule. This bile is going outside from the center to the periphery, so it has also got centrifugal arrangement. The flow is centrifugal. Now bile ductule of all hepatic cells, the all classical hepatic lobule, this bile ducts get gathered, bile ductule, this green one is the bile ductule, and then all these ductule unite to form the bile duct. This is the, in green color, this is the bile duct. Then right and left hepatic duct. This green one is the right and left hepatic duct. From the gallbladder, this is the cystic duct. And then right and left hepatic duct here. You can see the right in green one, this is the right hepatic duct, and this is left hepatic duct, and this is the common hepatic duct. Now common hepatic duct unite with the cystic duct to form the common bile duct, which along with the, here is the pancreas. The pancreatic duct opens through the ampulla of water into the second part of the duodenum. This is our biliary circulation. And how the blood enters? The blood enters from the whole of the GIT, spleen and the pancreas through the portal vein, and from the abdominal aorta, hepatic artery. All these tubules are coming into the sinusoids, then going into the central vein. From the central vein, this is the central vein. This central vein forms the sublobular vein. These all are central vein. Then unite to form sublobular vein. This sublobular vein, this one, sublobular vein from all the side unite to form the hepatic vein. There are three hepatic vein. This is the hepatic vein. This is the left hepatic vein, this is the middle hepatic vein, and this is the right hepatic vein. All these veins drain into the inferior vena cava. Okay. Now come to the hepatocyte. It has multi-phased cell, and the microvilli is there. It synthesizes many things, that is the plasma protein, albumin, and then it pushes back into the space of Dc. The product which is pushed back into the space of Dc is going to the general circulation, and the drug also get metabolized, and the term is biotransformation. The drug biotransformation has done, and then again pushed back into the space of Dc is going through the excretory product of that is going through the urine. And if the conjugation done, then active secretion occur through this biliary canaliculi, and then to the duct of Hering, to the cholangiole, to the bile ductule, then bile duct, and bile duct opens into the second part of the duodenum and then excreted through the our GIT. Okay, so that will pass through stool, and one which is expelled back to the space of Dc is passed through the urine. Okay, this is the one thing very important. And this hepatocyte, this is the nucleus. This black one is the nucleus, and it becomes enlarged as the age increases, and I also become many in number as the age increases. And it is full of peroxisome, lysosome. There is many mitochondria inside. The smooth endoplasmic reticulum, rough endoplasmic reticulum is there. Smooth they are for the packaging purpose, and they are forming lipids. They are forming lipoprotein, SDL, LDL, VLDL, and pushed back into the space of Dc and going into the general circulation through the lymphatics. This yellow one, lymphatics. Okay, so this is our classical hepatic lobule. If this here the main role is the central vein. In the center is the central vein. Here is the general circulation. The general circulation is so in this through this the classical hepatic lobule, we are showing the is endocrine status of the liver. And when we talk about the exocrine part of the liver, then comes the role of portal lobule. Portal lobule, how it is formed? It is formed by an imaginary line. If we connect the central vein, it is a triangular space connecting the central vein two sides, and one is also central vein connecting three central vein, And here is this, at the center there will be portal tetrad, that is the bile duct, hepatic artery, portal vein. All this lies at the center. So it shows the exocrine part of the liver, because bile duct is at the center and the central vein, which is going into the general circulation, is at the periphery. So portal lobule is showing portal lobule is showing is exocrine part, the exocrine part of the liver. Where is the hepatic lobule? Classical hepatic lobule is showing the endocrine part of the liver. Exocrine part is going to the biliary system. Endocrine part is going to the general circulation. This is the difference. And if we talk about the functional status of a liver, then again a diamond shape structure is formed in between the hepatic lobule, in which the long axis, this is the long axis, is in between the connecting the imaginary line connecting the two central vein, and the short axis is in between the two classical lobule. This one is the short axis and this is the long axis. This is a diamond shaped lobule is the hepatic acinus, which deals with the functional status of a liver, in which from periphery to center of a hepatic lobule, it is divided into zone 1, zone 2, zone 3. Zone 1 is richly supplied by the oxygen. Zone 2 is comparatively lower oxygen. Zone 3, that is pericentral. Pericentral zone is very much deficient of the oxygen. So the peripheral area which are getting more oxygen. Why there is more oxygen? Because the oxygen. So coming to the hepatic acinar system, which is a diamond shape, and this is the zone 1, zone 2, zone 3 in the periphery, richly supplied by the oxygen. They are getting more oxygen, more nutrients, more toxins even. So more oxygen and they are getting less oxygen. So if there is ischemic necrosis, ischemic necrosis of the liver, this area, pericentral zone, is going to be suffered much more than this peripheral area. This is one thing. And in case of any toxins, towards the portal tetrad, this area, that is the zone 1 area, is going to be suffered more, because it is here it is getting more toxin, more microorganisms. So if there is inflammation, is there infection, in case of inflammation, more neutrophils, more macrophages are there. In case of infection, they are getting more microorganisms, this area, the zone 1 area. Even though it is richly supplied by the oxygen, it is also richly supplied by the microorganisms as well as the toxins. So in case of toxin overdose, or in case of any drug overdose, these areas is going to be, zone 1 area is going to be more suffered comparative to the pericentral zone, or that is zone 3. So this hepatic acinus deals with the functional status of the liver. Okay. Now one thing I would like to mention, that the Kupffer cell lies in the sinusoids. It is in whole of the sinusoids. It is by the side of the wall. Okay, Kupffer cell. which engulf the degraded product of RBC, WBC, platelet, also deals with the microorganisms. And this one is the ito cell. Ito cell lies in the space of Dece. This yellow one is the space of Dece, and this one is the cholangios in which bile runs, centrifugal course, and this is also centrifugal course, but here is the lymph in the space of Dece, where lies the ito cell. The function of ito cell is to store vitamin A as well as the fat. Okay. And when it get irritated, why it get irritated? Because in case of chronic inflammation, in case of hepatitis A infection, hepatitis B infection, it get and any other infection which becomes chronic, then it get stimulated by the inflammatory agents, and then it convert into the myofibroblast. Myofibroblast forms much collagen. Due to the formation of collagen in this whole of space of Dece, and also this is here is the collagen. This is here the more formation of collagen by the ito cell in the space of Dece here also. So this area, that is the sinusoidal area, get constricted by the fibrosis. Okay, so there will be fibrotic changes which lead to ischemia, because the portal vein and the hepatic artery do not deliver proper blood to the central vein. This circulation is obliterated somehow. So there will be, and there is fibrosis, and in some area there is hyperplasia, there is hypertrophy. So hypertrophy as well as the fibrotic changes, which is known as cirrhosis. Okay. So in case of cirrhosis, liver cirrhosis, this ito cell has got very great role, because it changes into myofibroblast, which forms too much collagen, and the fibrotic changes occur. Okay. So this is all about the histology of liver. Thank you.